Thyroiditis. That is the topic. This thyroid gland, it can be affected by different type of diseases. It can be congenital, or it can be any sort of infection. It can be autoimmune or benign condition or malignancy. Riedel's thyroiditis, it comes under the group called autoimmune disease. So let me first tell you what is autoimmune disease. Autoimmune condition, every person inside their body, they have a protective mechanism system. So that is called as immune system. If any foreign material like bacteria, virus, any sort of allergy, it tries to attack our body, this immune system gets activated and it will fight against them and it will destroy it. In autoimmune condition, what happens is this immune system, the body immune system, gets activated without an intervention of a foreign material. There is no invasion by a bacteria, virus, or allergy of any sort. So it gets activated and it starts attacking the own body parts. In Riedel's thyroiditis, it happens to be the thyroid gland. So here we have autoimmune system activated and IgG4, which usually is very less in the body. In this condition, it is more, and it gets activated against the thyroid gland. It destroys the thyroid gland, resulting in fibrosis. That is what is happening. Now, this is more common in females between the age group of 30 to 50. And the patient complaint is going to be, they say there's an enlarged thyroid gland, which is painless and slowly progressing. And as and when it progresses, it can involve the surrounding structures. So it involves the nerves, or it can involve the windpipe like the trachea or the esophagus also. So it results in, as and when the thyroid gland becomes bigger, it can result in difficulty in swallowing, the patient is not able to eat properly, and cough that is continuous, which is troubling the patient, change of voice, and finally the patient will have difficulty in breathing difficulty. Slowly progresses. So when we examine the patient, the thyroid gland will be very hard, as if you're touching a wood or as if you're touching a very hard structure. Because of this feeling, there's one more name for this condition, so it is called as woody thyroiditis. Now, coming to the investigations. When you do a blood test, the thyroid hormone levels will be less because the thyroid gland is slowly getting destroyed. So TSH will be high, T4 level will be low. We need a diagnosis. So when you do an IgG4, which generally is the least in the body, in this condition, the levels will be high. And if you do any inflammatory markers, or like we do a complete blood count or C-reactive protein or ESR, it will be normal. Even TPO antibodies is going to be normal. We need a diagnosis, and we have already diagnosis with high level of IgG4. Along with that, if we do a thyroid scan, normal ultrasound scan, it will be reported as hypoechogenicity, and you'll see that it will show that the gland is enlarged and it is invading the surrounding structures. And we need a biopsy. So since the gland being very hard, like an wood feeling, getting a cell out, a few tissue out with the needle is going to be difficult. So we need a biopsy for that with the help of true cut biopsy. So that is also going to help us in diagnosis. Now, that this condition is managed initially medically with steroids and other medications. If it so happens it is progressing and the patient has got complication, we have to plan for surgery. In that case, we need CT scan or MRI. So if you ask me which is better, the answer is going to be MRI scan. So we have diagnosed with a high level of IgG4 and a biopsy. Now, this condition is usually associated with other autoimmune conditions, like there will be fibrosis behind the peritoneum, and the ears can be infected with which is infected. It is a sterile collection, and we can have other conditions like the pancreas can get involved. In the early stage, we can try to slow down the progress of the disease by starting steroids. If the patient is resistant to steroid, we have other alternative medications like methotrexate or tamoxifen. Of course, these patients, they need thyroid hormone replacement, levothyroxine, because there is no production of thyroid hormones. So L-thyroxine has to be replaced. That will go on for lifelong. Now, if the patient disease is progressing and they have got complaints like breathing difficulty, swallowing difficulty, change of voice, then we need to remove the thyroid gland. So what I mean to say is they may need thyroidectomy. So this is how we manage this autoimmune disease which presents as a rocky, hard thyroid gland called Riedel thyroiditis. This is how we manage. Thank you so much.